Lifestyle medicine for COVID-19 and NCD care, a wake-up call. This event is proudly supported by the Lifestyle Medicine Global Alliance, the American College of Lifestyle Medicine, the International Board of Lifestyle Medicine, the Department of Health, and the Philippine Medical Association. The Philippine College of Lifestyle Medicine is also supported by several institutions pioneering lifestyle medicine practice in the country. The Remnant Institute Incorporated, a center for lifestyle medicine and education. The Adventist Medical Center, the Four Leaf Lifestyle Medical Group Corporation, the Plated Prescriptions, and the Culinary MD. This event is also made possible through the help of our sponsors, the Pascual Pharma Corporation, the Omron, Simply Nature, and the Foligo.
When accuracy becomes embedded in technology, when medical becomes personal, when life presents zero compromises, that's the sign of the future of healthcare, a future with Omron. Omron is devoted in creating innovative products and services for the benefit of everyone's health, opening possibilities in health management that can be integrated in everyday life. For decades, Omron has made blood pressure measurement at home accessible, designing each device with unique vital sensing technology and rich clinical data to provide the best quality on a global basis. Omron's range of products help people lead healthy and secure lives, conveniently sized, precisely fit, and accurately detecting, whether you're at home or out and about. Omron's state-of-the-art products makes health management easy. They allow people to live a life of zero events, a life with reduced incidence of diseases caused by high blood pressure. Omron has led the advancement of blood pressure monitoring, penetrating the global market as a competitive brand that assures quality and accuracy. Though it took more than 35 years before the first 100 million units of Omron blood pressure monitors to be sold worldwide, 200 million units were sold by 2016. Showing how Omron Healthcare have been rapidly penetrating the global market. Compelled to forge a healthy future for individuals, Omron's monitoring devices are easy to use yet medically accurate, which is why Omron's monitoring devices are likely recommended by doctors here in the Philippines and in various regions. Omron knows the importance of detecting hypertension in its earliest. That is why Omron's blood pressure monitors for home use are designed with innovative features from precise feed cuffs, advanced accuracy technology, to Bluetooth data accumulation. Everybody can monitor their heart health efficiently and know when to be aided medically. Accessibility, quality, accuracy. These are the qualities why Omron's blood pressure monitors are validated by the Philippine Society for Hypertension, showing outstanding results for both past and present models. Omron is available within reach, so everybody can take charge of monitoring their heart health. Everyone can now look forward to a future of personal health management, a future when medical technology has reliable accuracy, a future when medical assistance is just a tap away, a future when life has zero events, zero compromises. This is the Omron future. This is Omron Healthcare.
Dr. Kathyn Joyce from Gorriceta earned her medical degree from the Iloilo Doctors College of Medicine and finished her internal medicine residency training at Western Visayas Medical Center. She is a diplomate and fellow of the Philippine College of Physicians. She is also a diplomate of the International Board of Lifestyle Medicine. She is currently a specialist at the Western Visayas Medical Center. Kindly give your undivided attention to Dr. Kathyn Joyce Gorriceta as she talks about integrating lifestyle medicine in public hospital services.
Greetings of good health, everyone. I will be talking about integrating lifestyle medicine in public hospital services. For my objectives, we will be answering the following questions. First is, why should we integrate lifestyle medicine in public hospital services, wherein we will be discussing some of the lifestyle-related public health challenges today. Next, what should we integrate in our hospitals? And under this, I'll be mentioning the different pillars of lifestyle medicine that we should apply. Third, how will we integrate these lifestyle medicine programs? I'll discuss the best practices of the different hospitals in the US and also in the Philippines. And lastly, we will answer the question as to when should we integrate these lifestyle medicine programs in our hospitals. I have no disclosures or conflict of interest. According to the World Health Organization and Center for Disease Control, the following are the public health challenges today, but I will be emphasizing more about lifestyle-related diseases and issues such as nutrition and physical activity, climate change, and issues about healthcare service, costs, and delivery. Researchers have been studying the human genome for so many years, and we have yet to uncover the gene for all of the diseases. But to summarize their different studies, they have found no interactions between genetic risk profiles and lifestyle. The role of genes made little contribution to health outcomes for these chronic diseases, and the fault does not appear to lie in our genes, but our lifestyle choices, because evidence shows that one's genes do not necessarily define one's health. And so, to describe it, it's like genetics loads the gun, lifestyle pulls the trigger. Genetics may account for only 15 to 20% of the disease that we treat. This is just to show you that we can influence our genetic risk by changing our lifestyle. Because, like, for example, the genetic influence in coronary heart disease is only 21%, or in stroke, for example, it is only 13.8%. So in short, 80 to 90% is actually influenced by our lifestyle. So how can we live healthier and prevent these chronic diseases? Is it genetics, environmental factors, or it's just you? It is you, because it's only you that can live healthier and prevent chronic diseases through these modifiable risk factors, or risks that can be avoided by lifestyle changes and are largely responsible for the leading causes of death. As you can see, most of the chronic diseases are caused from tobacco use, poor diet, physical inactivity, and poor nutrition. In short, all of these are lifestyle related. Another public health challenge is climate change. The CDC has identified it as a health emergency in the 21st century. The world's climate crisis has major health implications. According to the National Institute of Environmental Health, more than 25% of deaths from chronic respiratory disease, heart attack, lung cancer, and stroke are attributed to tobacco, smoke, and pollution. In this data, the WHO highlights the leading causes of death in the world, and most of them were non-communicable diseases, which accounts for 74% of all deaths recorded worldwide. Cardiovascular disease remains the leading cause of death, along with the rising incidence of cardiovascular disease risk factors such as hypertension, obesity, and diabetes. According to the CDC, 90% of the nation's $3.8 trillion annual health expenditure are for people with chronic diseases and mental health conditions. In this data, among the top leading causes of death in the Philippines, in January 2019 and 2020, by the Department of Health, the top 3 causes of deaths are due to ischemic heart disease, cerebrovascular disease, and cancers. As I've shown you earlier, non-communicable diseases account for 68% of all deaths in the Philippines. This report highlights the growing need for investing in the prevention and control of communicable diseases in the Philippines. The economic cost of non-communicable diseases to the Philippine economy is 756.5 billion per year, which is equivalent to 4.8% of the country's annual gross domestic report. Non-communicable diseases in the Philippines are causing a surge in healthcare costs and social care and welfare needs. This cost includes the direct cost of non-communicable diseases associated with treatment, care, and social security provision, but also indirect costs that arise from loss of workforce and reduced productivity. This report presents evidence that investing in preventing non-communicable diseases is highly cost-effective. This report also shows a return of investment analysis that suggests that for every Philippine peso invested in the selected prevention policies, there is a return of 7 to 29.9 pesos, which is a 377.7 billion return of investment over 15 years. In particular, the SALT policy package has the highest benefit to cost ratio when considered across a 5-year and 15 years timeline. We healthcare providers may wonder that despite the advancement of diagnostics and medications, why still a high percentage of these lifestyle-related diseases? Are we really addressing the problem? Or are we just handing out Band-Aids wherein the patient continues to cut themselves and give them another Band-Aid? In this data, we can see that our patients are not provided with proper information and knowledge to address the problem. Almost 60% among smokers are not properly advised. Only a small percentage of pre-diabetics are only given dietary recommendations. Exercise and weight management are not also emphasized. In our approach in preventing and treating these lifestyle-related diseases, we should be an upstreamist because upstream interventions are key to lifestyle medicine. We should always ask the root cause when it comes to most of the chronic disease conditions. If we can get the root cause, we can seek more preventive solutions and look for ways to reverse disease instead of treating the symptoms. What now are the challenges in our healthcare services? These statements were from a panel discussion during the American College of Lifestyle Medicine conference last November 2015. And they described that hospital systems are called healthcare, but actually, it's more of an illness care or injury care because we treat the symptoms rather than the causes. Most of the hospitals failed to embrace a more proactive position toward healthy lifestyle and prevention, based mostly on the lack of financial incentives and the lack of knowledge and training of healthcare providers. Again, as I've mentioned, what is happening now is that we keep on giving our patients Band-Aids. The patient cut themselves and you give them another Band-Aid. But with lifestyle medicine, we stop the cutting, so there's no more Band-Aids. Integrating lifestyle medicine in our hospital services, which embrace primary, secondary, and tertiary prevention, is the most sustainable and cost-effective solution of these challenges in our healthcare system, and can also improve and decrease economic burden of many chronic conditions, while also fulfilling our obligation to provide the best possible healthcare, not only to patients, but our employees, healthcare workers, and families. So what can we offer to our patients in order to reduce readmissions, reduce costs of care, and a healthier patient? In transforming current disease care system to a healthcare system in the context of lifestyle medicine, we should integrate these 3 pillars of wellness, namely the physical, financial, and interpersonal pillars. Inpatient food programs, such as increasing fruits and vegetables and healthier drinks in the cafeteria, lifestyle education, physical activity, and therapies within the hospital system can improve patient health and empower not only patients, but employees and healthcare workers to engage and improve their own wellness. For interventions to be sustainable, hospital administrations require interventions to be cost-effective. Hospitals are always forced to weigh the cost of an intervention or service against the health benefit for the patients. Financial issues are a huge concern for today's workers. Much like exercise and eating well, financial well-being is key to living a happy and healthy life. In integrating this pillar in our hospital services, we should have tuition assistance or reimbursements wherein the employer will pay all or part of an employee's wellness and intervention programs. There are many health issues among employees, just like stress, illness, and unhealthy environment, which results in mental health issues, sickness absenteeism, or subnormal performance. That's why wellness in our hospital setting plays an important role in creating healthy environment. We should incorporate wellness programs that can ensure early detection of lifestyle disorders and other illness because this will help not only for our employees, but our patients as well in being more aware of their well-being, taking the right steps in the right direction, and improving their health and performance. In my next slides, I will be showing some of the hospitals which have successfully integrated lifestyle medicine in their hospital services. And one of these is the lifestyle medicine at Loma Linda University Health Hospital. The practice of lifestyle and preventive medicine services has been the core to the mission and vision of Loma Linda Hospital. Their outpatient lifestyle medicine consultation was designed for continuity of care for inpatients and for primary care referrals to prevent and even reverse chronic diseases. Other service programs include nutrition programs, employees' wellness programs that encompass weight management and diabetes, among others. In New York City health hospitals, they have a plant-based lifestyle medicine program and other programs that focus on 6 aspects of lifestyle changes, such as healthy plant-based diet, physical activity, social connections, and avoidance of risky substances such as tobacco. They have cooking demonstrations, classes on grocery shopping, meal planning, sleep, exercise, and sleep management. UCLA Ornish is a nationally recognized lifestyle medicine program. It is the only scientifically proven program to stop the progression and even reverse the effects of heart disease. This is an outpatient program wherein participants experience stress management, emotional group support, exercise, enjoy a nutritious plant-based meal, and listen to educational lectures. Adventist Health Lifestyle Medicine Institute is now a wellness membership program that aims to treat the person as a whole. Patients can closely partner with their provider on their healthcare journey. They are offered benefits such as personalized lifestyle education, in-depth visits that include lifestyle and health assessments, customized wellness plans, accessible healthcare to lower-income families, and additional health resources. This article describes Orlando Health and its initiative to incorporate lifestyle medicine concepts into its core operating principles. Its mission statement embraces the principles of lifestyle medicine as essential of modern healthcare. The Orlando Health further engages and reaches out into the broader communities. In the Philippines, we have the Adventist Medical Center in Manila, wherein they have the Complete Health Improvement Program, or CHIP, which is a scientifically proven lifestyle intervention program that can prevent, arrest, and even reverse today's most common diseases. The program helps participants make lasting lifestyle changes within 30 days. In my institution here in Iloilo City, the Western Visayas Medical Center, which is a government hospital, we have adapted wellness programs such as the Hataw program, where employees have physical activities such as exercises and Zumba classes. We also have the Diabetes Wellness program, both for the patients and the employees. And we do lay forums about lifestyle-related diseases, smoking, nutrition, and nutrition education. So why should we integrate lifestyle medicine in our hospital settings? Most chronic diseases are preventable and are a matter of poor lifestyle. We should be getting the root cause not only for prevention, but also for the treatment and reversal of the disease. We need to have a whole overhaul and a paradigm shift to a healthcare system that treats the cause rather than the symptoms. A system that can help create wellness that is sustainable, cost effective, and leads to a substantial change for the good. With this transformation, we will not have separate programs for diabetes, heart, or hypertension programs. It's all one program. It's lifestyle medicine, because in integrating lifestyle interventions, we help people become healthier. We keep them out of the hospital and lessen readmissions. One common denominator for these model hospitals I've mentioned is that they have one healthcare system wherein they incorporate lifestyle medicine concepts and have profoundly used the pillars of lifestyle medicine as its core operating principles. Their effective implementations are mainly because of a shared goal among patients, physicians, and the healthcare organizations. There should also be a knowledgeable healthcare provider who gives adequate time to motivate patients and give effective interventions. In integrating lifestyle medicine in our own institutions, these hospitals can serve as templates for us to also embrace our roles in promoting and incorporating the pillars of lifestyle medicine in the mainstream practices of modern healthcare. COVID-19 is undoubtedly one of the most complex viruses that has ever challenged humanity, and unfortunately, those who have lifestyle-related diseases are the most at risk and have the highest mortalities. And so, may we, the healthcare providers, most especially the lifestyle medicine specialists, be more invigorated to work and to keep on fighting to address unhealthy behaviors. And so, to our question as to when we should integrate lifestyle medicine in our hospital practices, it should start now, since it has been long overdue, and most especially because this is a period where a healthy lifestyle and behavior is our only primary defense. So before I end my lecture, let me share with you a quote from Nelson Mandela, and he says, "An educated, enlightened, and informed population is one of the surest ways of promoting the health of a democracy." We need to be vocal advocates so that good and healthy behaviors that starts in us will be carried on, not only to our patients, but to our communities. We need to make the people be aware that lifestyle changes are effective tools in the treatment as well as prevention of disease, so that more patients will be educated, motivated, and will sustain a change that will ultimately lead them to better health and well-being. Integrating lifestyle medicine in our hospitals will definitely have its challenges, but I know it is not by chance that we are here, committed and passionate to keep fighting for what we know will ultimately be required to improve the health of our country. At first, it will always be difficult, but as long as we have this shared dream of healing and preserving lives, we will always have the reason to work and respond to these challenges, because nothing seems to be impossible until it is done. Thank you for your kind attention. Stay safe and healthy. God bless us all.
Lifestyle medicine for COVID-19 and NCD care, a wake-up call. This event is proudly supported by the Lifestyle Medicine Global Alliance, the American College of Lifestyle Medicine, the International Board of Lifestyle Medicine, the Department of Health, and the Philippine Medical Association. The Philippine College of Lifestyle Medicine is also supported by several institutions pioneering lifestyle medicine practice in the country. The Remnant Institute Incorporated, a center for lifestyle medicine and education. The Adventist Medical Center. The Four Leaf Lifestyle Medical Group Corporation. The Plated Prescriptions. And the Culinary MD. This event is also made possible through the help of our sponsors. The Pascual Pharma Corporation. The Omrin. Simply Nature. And the Foligo.
Our vision is to be distinguished as a fast-growing Filipino pharmaceutical company advancing a legacy that provides reliable, high-quality health and wellness that are responsive and relevant to the changing needs of patients and customers. Blumea balsamifera sambong leaf. Relief Forte. The longer, the better. Relief Forte. Relief for urinary stones. Acetylcysteine, Acetimax, dissolves mucus to the max. The number one 50 milligram sildenafil brand in the Philippines and the most prescribed sildenafil citrate in the market. Zilden, now on its 10th year. Manage your BP. Protect your kidney. Like a pro. Irbipro, the certified safe irbesartan. The only prescription-grade L-carnitine available today. Enhance your heart score with Carnicor. ACE inhibitor enalapril is recommended by the ESC for heart failure with reduced ejection fraction. Enalapril maleate, high pace, keep their hearts at pace. Eliminate potassium loss worries during diuresis. The only furosemide with potassium. Diamide K, ang furosemide na may K. Pregabalin Pregasafe with triple A effect, analgesic, anti-epileptic, and anxiolytic. Pregasafe, no pain, all gain. Fluocinolone acetonide, Aplocin, the reliable topical corticosteroid for acute and chronic dermatosis. Aplocin. Brought to you by Pascual Pharma Corp. Building a legacy of care.